Good morning. My name's Nina Somerville and I'm the lead paediatric respiratory nurse specialist at Frimley Health. I'm here to discuss a good asthma review and hopefully do this within your clinical settings. So the first thing we're going to talk about is actually reviewing the patient's notes. The first thing we'd be looking at is there a diagnosis of asthma? So can you see this recorded in the notes? Who made the diagnosis? And that can potentially give you some insight into whether this does need to be explored during the appointment. The next thing would be looking at if they've attended primary care, urgent care, or secondary care for any acute treatment in the past 12 months. So we'd want to see if they've had any oral steroid prescriptions, which may indicate they have poorly controlled asthma, especially if this is regular. And the next thing that you can also review is the prescription history. So are preventer inhalers collected regularly? So a 200 dose inhaler would last about 6 weeks, whereas a 120 dose inhaler if taken twice daily would last about a month. And the next thing to look at is how many reliever inhalers have been prescribed, because regular reliever inhaler prescriptions also indicates that asthma potentially is poorly controlled. And this just gives you a bit more information about how the patient's asthma may be, and is just a starting point of what questions you may have for them or anything that you would like to discuss. The next thing would be then when you have the patient with you, so actually assessing their asthma. So sometimes a good starting point is using something like the asthma control test. So this is a validated questionnaire, and it can give some insight into how the child, young person, or the parent or carer feels the asthma control is. And this can lead to some questions for you. So for example, if someone is having regular symptoms and they say their asthma is then well controlled, that may give you some insight into what their knowledge and awareness of asthma is. In terms of physical assessment, having an up-to-date height and a peak flow measurement is really useful. So we know the patient's best peak flow, and they can also then have more education on how they actually use the peak flow meter if their asthma is poorly controlled. You can then check things like their inhaler technique, so actually having them use their inhaler, or if you have placebo inhalers provided in your clinic, getting them to show you how they use it, because that could give you an indication of if asthma is poorly controlled. That could be one of the issues affecting them. Or it could be if they're obviously using the inhaler incorrectly, you can modify that and hopefully that improves their asthma. It's always really good to explore the patient's triggers, so having these documented in the notes and then kind of rediscussing them, because there may be new triggers. You can address things like smoking in this. You can also think about, if they are smoking, referring them to smoking cessation services. If they have pets in the home and this is aggravating the symptoms, trying to minimise exposure. Giving different tips and tricks. So for example, if they find walking on busy roads is exacerbating their asthma, trying to kind of take quieter roads, and just giving them some proactive strategies that they can use to hopefully manage things a little bit better. And another thing would be assessing if they have any comorbidities. For example, if they have hay fever, making sure that that treatment is also optimised to make sure that all the conditions are working well. Next, we move on to education. So in our asthma clinics, we really like to use airway models. So you can use models on the computer like this, or you can actually purchase physical airway models. And this is a really good way of actually showing the person what is happening in their airways. So for example, on here, we can see the normal airways nice and open, nice and healthy. But in the asthmatic airways, we can see there's inflammation, there's lots of mucus, and there's also the muscles squeezing around the airways. I find this quite useful to then discuss the medications and how they work. So the preventer inhalers reduce the airway inflammation, and then the reliever inhalers relax the smooth muscles around the airway, but they don't treat the inflammation in the middle. So hopefully that can address if a person isn't using their preventer inhaler enough. This may be a way of actually showing them why it's important. The next thing would be obviously if they don't have good inhaler technique, or say if they're not using a spacer, show them how to use the inhalers. It's also a good idea to send them resources afterwards. So Asthma and Lung UK have lots of videos for every inhaler type, and that's just a useful way of signposting someone so they can actually check. Because if you've shown them in the appointment, they may register that in that moment, but they may need a reminder and something to watch so they can follow along and make sure they're doing the right thing. If you're changing them to a different inhaler device, again, you need to make sure that you are showing them how to use this. Community pharmacies can also help with this as well. And then the kind of final part, and it's something that everyone should have, and we should be doing this with them, is having a personalised asthma action plan. So this is an example plan from Asthma and Lung UK, and it has a space of writing where the patient's triggers, anything that you can do to mitigate those triggers. For example, if pollen is a particular problem, we'd say take an antihistamine. And there is a traffic light system, so it shows them what to do every day and what to do if things are getting worse. So it's a good way of showing them what to do if their asthma is deteriorating, so they can seek help earlier, and also information on how to manage an attack. For children and young people particularly, we encourage this to be shared with schools, so schools know what to do. And then we also, if they are managing their asthma a bit more independently, that they also have a copy of this. People may also like this digitally, so you can fill out these plans digitally, or you can have physical hard copies. And then finally, the Healthier Together website has lots of information. So it does have information for parents and carers, and there is an asthma page. There's also information for professionals. So we have information on here about asthma training, risk stratification for asthma, and the referral pathways into hospital should you see anyone that has poorly controlled asthma and may need some more intervention. You need to think about follow-up in the next step. So in general, asthma should be reviewed at least annually, and this is to ensure that the person's asthma management is working for them, to address any concerns you have, such as adherence or needing to use their reliever inhaler frequently. But it also should be performed more often if asthma is poorly controlled. So we should say, yes, this needs to be reviewed at least every year. But if you're finding your asthma is causing you problems, so if it's interfering with your activities, if you're waking up at night time, if you're finding you're using more of your reliever treatment, that is a sign to have asthma reviewed sooner. After an attack, we advise that the person is reviewed 40 hours or the next working day after the attack. And this is to make sure that the attack is over and to potentially identify the trigger. So for example, if smoke exposure is the trigger, making sure we're addressing and giving smoking cessation advice and referring on to stop smoking services to support that person to stop smoking. You should then have a full review 4 weeks later, and this will be a review of everything in terms of the asthma management. And this is just to identify any modifiable factors that can help to prevent this happening again.